Hello and a very good afternoon to all of those joining me live on the Facebook page of News 9. I'm Neha. A few people who have recovered from COVID-19 are now experiencing brain fog. They're suffering from symptoms such as memory loss, fatigue, dizziness, etc. Many others who have recovered from the highly contagious disease are experiencing difficulties in concentrating, headache, sleep disturbance. In fact, in many other cases, patients were also not able to read and write easily or focus on work. Most of these symptoms were witnessed in patients above the age of 60 who first tested positive and then recovered. In fact, in certain other cases, patients have returned even 2 months after they recovered from COVID with symptoms of brain fog. In fact, paper which was recently published links brain fog to post-traumatic stress disorder, commonly known as PTSD. The experts still cannot really explain the exact reason for the loss in normal brain functions post-recovery. Now, to speak more about the same, joining me over the phone line is Dr. T.R. Hemkumar, who is a consultant of internal medicine in Sakra World Hospital. Many thanks, doctor, for joining us. Now, first,
thanks for the invite.
Right. Doctor, first, I would like, to ask you, break it down for us, what causes brain fog? And, you've treated a few patients who experienced brain fog. So, would you be able to elaborate about the symptoms that the people who have recovered from COVID-19 are experiencing?
Yeah, so the terminology, the newer terminology, one of the fresher terminology, brain fog, has got into our day-to-day use after this COVID-19 recovery. Patients are presenting with some symptoms which are very peculiar new onset symptoms like sleepiness and lack of sleep, both. Some patients experience increased sleepiness. Some patients experience less sleepiness in the night time. Irritability in the sense they get angry easily. They are restless. They are not able to communicate comfortably with the family members or the peers. They get easily angry. They feel low in mood, depression, and also they feel lack of concentration. Usually, people of higher designations, executives, they are able to differentiate that they are not able to concentrate, focus on the work which they have been doing very easily before the COVID illness. And also, they can have stroke-like symptoms, which is very easily differentiated from this low mood. The stroke is more of a neurological, and the brain fog, what we are seeing, is more of a neuropsychological or psychiatric disturbances.
Well, doctor, in some cases, short-term memory loss was also reported, if I'm not wrong.
Yes, there has been some patients finding it difficult to remember small recent things, not like particular amnesia, but they are not able to register new things into their mind and recall what has been happening in the immediate past. That is just before we examine them, just before we talk to them, just like simple absent-mindedness. They forget what they have eaten for breakfast, what they have been doing just before they came to the hospital for a follow-up, something like that.
Mm-hmm. But why is it happening, doctor?
So we don't have a clear answer to this question.
Okay.
We have a hypothetical answer to this question. Couple of them are during COVID infection, COVID pneumonia. When the patients are hospitalized, they are isolated for 2 weeks almost. Mm-hmm. So they remain in isolation and they don't have a real human contact, though doctors, nurses are frequently visiting them. So most of them are in the personal protection equipment. So they are not able to connect with the people. But it has been little lesser nowadays because initial days they were not allowed mobile phones. Now they are having mobile phones, they are having video calls, but still they don't have that direct human contact.
Right.
Second thing is they are on medications like steroids, which are actually slightly stimulant drugs. So it stimulates the brain a little more. So they have less sleep when they are on these steroids. This could be second reason. But the most plausible explanation could be some of the patients might be having something like an encephalitis. Encephalitis is inflammation of the brain tissue.
Okay.
When the patient gets infected with COVID, the COVID virus can be attacking, the SARS-CoV-2 virus can be attacking various parts of the body. So it can be growing in the respiratory tract, that is the throat, also in the lungs. It can affect any part of the body. In the heart, it is called as myocarditis. So like that, it can even affect the brain and cause something called as encephalitis. Though there are patients with severe encephalitis documented in our ICUs of ICUs treating COVID patients, there could be milder forms of this encephalitis, which is affecting these people's brain, which in turn causes long-term brain dysfunction.
Okay. So, doctor, most of these symptoms are witnessed in people who are above the age of 60. Does age also affect the patients who are, affected with brain fog?
Probably, yes, because the general cognitive function of the people who are above 50 is slightly lesser when compared to younger people. But I would not say this is restricted to people above 60.
Okay.
The most people who are presenting with this are above 60. But others have seen a couple of patients who are in the mid and late 40s who were very active during the pre-COVID period, has come with similar symptoms: irritability, lack of concentration, little memory loss, sleep disturbances. So with these symptoms they have come.
Right.
In majority it is above 60, but I think as we go into this pandemic, we will be getting more number of cases in the middle and younger age group too.
Right. Doctor, how does a person who has recovered from COVID and is now experiencing the symptoms deal with the situation? Is there any particular medication that you have prescribed to your patients?
Again, there is no single solution to this problem. What we usually do is, to avoid a stroke, we give some blood thinners and statins, which are anti-inflammatory in nature, so which will improve the blood flow to the brain. They might be helpful. Second, we can give some vitamin supplements, vitamin E, which could be beneficial to the brain, which can slightly improve the memory and concentration, though they are not, they don't have a significant turnaround of the symptoms. But we can try these medication. But in general, if we see, what we can do is a gradual tapering of the steroids, which the doctors will be doing anyway at the time of discharge. Maintaining a good sleep-wake cycle. So once they are back home, they can have a proper 8 hours of sleep in the night time and reasonable physical and mental activity during the daytime, graded physical activity in the daytime, and also avoiding excess screen time, avoiding emotional circumstances, and trying to be calm, doing some meditations will all be helpful. But we might require more studies and more information, data before we embark into treatment of this problem.
Right. Lastly, doctor, I'd like to ask you, is there any time duration as to how long these symptoms really last, or do they go away with time?
So as of now, our knowledge of COVID is very young. So in our cities, Bangalore particularly, the COVID has been there for past 3 months. Mid-June we started with an increase in number of cases, and we are in October, mid-October, almost 4 months, 120 days of real pandemic situation in Bangalore. After the unlock 2, we have started seeing these patients. So in this 4 months period, we have seen patients coming with these symptoms after 1.5 to 2 months of duration. So now as we gain more duration into the pandemic, we might be knowing how far the symptoms are manifesting and how long they will last. As of now, what we have seen is that probably it manifests around 1.5 to 2 months, and it slowly recedes by around 90 days. And WHO has classified any symptoms appearing beyond 90 days as non-COVID, non-post-COVID symptoms. So up to 90 days, we consider it as a post-COVID sequelae only. And we don't know. We have to go into the
we have to dig deeper
to find out the answers.
Right. Thank you so much, doctor, for joining us with all of those valuable inputs. Well, there you heard the doctor. He says, try to remain calm. That helps. Of course, there are still many questions that remain unanswered. And with the complex nature of the virus, it makes understanding about it even more difficult. If at all you like this video, do not forget to subscribe News9 YouTube, like us on News9 Instagram, Facebook as well as Twitter. Stay safe, take care of yourself, keep those masks on to keep COVID-19 at bay.